So coronavirus is spreading fast, but there is no need to panic. There are some really easy and simple ways of keeping yourself safe. The most important thing of all is to keep your hands clean. You want to be washing your hands once an hour, maybe with soap and water or a sanitizing gel. The reason that's so important is that the virus spreads through droplets. The droplets don't hang in the air for an awful long time, but they fall onto surfaces, and your hands are always touching surfaces. And that's why washing your hands is so important, because we pick up the droplets on our hands and then we touch them against our face. There's research that shows we do that 15 to 30 times an hour. Public transport is a key thing to be conscious of. You want to be aware of what you're touching. You need to touch things in these places, the handrails, the handles on a tube train. So all of those surfaces are likely to contain germs, and you're going to pick them up on your hands. So just be aware of what you're touching, and after you've touched it, make sure you wash your hands before you're touching your hands to your mouth or eating food with them. The other area that's important is your house. Droplets are going to spread onto surfaces around your house. The really obvious ones are kitchen surfaces, bathroom surfaces. So be aware that those are surfaces where viruses could gather and are likely to be shared around. And what you want to do is you just want to wipe those surfaces with soap and water a couple of times a day to keep them clean. Also with children, explain to your children how germs spread. Don't make them paranoid about them, but remind them that germs come from your nose and mouth. They end up on your hands. If you touch surfaces containing germs, you'll get them on your hands. And that's why it's so important for them to wash their hands before they eat, before they brush their teeth at night, just to keep themselves clean, and they will reduce their chances of getting the bugs too.
I am Dr. Ratna. I am a clinical microbiologist and infection control practitioner at Apollo Hospitals, Jubilee Hills, Hyderabad. As of today, there has been one confirmed case of NCOV or novel coronavirus which has been reported from our country, from Kerala. So how do we prevent this infection, which is causing lot of anxiety and lot of preparedness is happening around the world? What we have to do is, the best way to prevent getting infected is to avoid getting exposure to such cases. There are very few steps which can be followed to prevent this infection. First and foremost is hand hygiene. Ensure that you wash your hands regularly with soap solution, and if possible and your hands are not dirty, then alcohol hand solution can also be used. Second important thing is that never touch your mouth, nose or eyes with unwashed hands. That is another important thing, because that is one of the method of spread of the virus. Third thing is cough etiquette. So if you are sneezing or if you are getting a cough, don't do it openly. Make sure you use a tissue paper, and after use, throw it in a dustbin. And the cough etiquette basically means you cough into your sleeve like this. When you cough like this, you prevent spread of the droplets which come from your nose or from your mouth when you are coughing. In addition, if you are in close contact with people who have had a history of travel and are showing the symptoms of infections like cough, fever or cold, make sure that you wear masks. Make sure that when you are coming in contact with people who are having suspicion of this infection or a history of travel to the infected countries, then wear a mask and prevent contact with such people at least for few more days. Avoid going in highly crowded places and if you have had the travel history of going to any of these affected cases or international travel, and you find any signs of fever or cough or cold, do meet your doctor and seek medical advice. Similarly, if there is a travel plan, it is preferable that you avoid traveling to these affected countries, as the CDC and WHO has definitely given some travel alerts to these countries. But if it is unavoidable, make sure that you, again, as I said, carry your hand rub with you, ensure that you use your hand wash and frequently wash your hands at least for 20 seconds, avoid crowded places, and do not touch your hands, do not touch your mouth, eyes or nose with unwashed hands. That is the most important thing. There is nothing much to panic. If we follow these simple infection control measures, then we can prevent the infection from occurring to us or getting transmitted to other people.